back live with Dr. Clay. So now we're going to talk about the actual procedure of a root canal, and perhaps maybe that'll calm my nerves down a little bit.
It actually will. So let's bring up that picture that we were looking at before with the infected tooth. So if you look at this tooth, the tooth that's on your left-hand side has a big dark area around the root, all right? That's the infection. That's actually what an infection looks like on an x-ray.
That's a good tooth.
And that's a pretty large infection, okay? If you compare that to the tooth behind it, it doesn't have the big dark area on the roots, right? So this patient can't live like this because her jaw is swollen, bacteria is running around her bloodstream. We want to remove that bacteria from her jaw. So we actually access the middle of the tooth by drilling a small opening at the top of the tooth. We clean out the entire area where the nerve and the blood supply used to live, and then we fill it up with an inert plastic material, and that seals the tooth from the rest of her mouth. Let's look at the next slide. So you can see the white line inside of the tooth.
Is that the plastic thing?
That's actually a plastic material that goes internal inside the tooth. And years ago, we wouldn't have been able to even fix this tooth because you can see at the very bottom the nerve splits and it becomes into two separate areas.
Years ago, that tooth would have had to be extricated.
Absolutely. Today's technique, we can fix these kind of teeth, and they work very, very effectively. She's no longer infected. And this was done a few weeks ago. If I then fast forward 3 years from now and take another x-ray, all the dark area that's surrounding that root will all fill in with bone. The tooth will become very stable, and there won't be any problem with it.
So what are the percentages of people walking around today that have teeth that ache, that require a root canal?
If you have a toothache, that means that the nerve has become inflamed and infected, and you're either going to extract the tooth or do a root canal on it.
What causes it again? Or root canal?
Again,
Just a bad hygiene?
No, it's not bad hygiene. You have start off with a small cavity in the tooth, right? Cavities are bacteria. If it gets a little larger, it gets inside to where the dentin lives.
Okay.
If it gets even larger, if it's unattended, you don't go to the dentist, you don't get the filling placed, all of a sudden, now it's inside of the blood supply of the tooth.
The pulp.
The pulp, and it gets infected.
Oh, wow.
The infection settles at the bottom of the root. Your jaw gets swollen. Voila, we need to do a root canal. Okay? Let's look at another one. Go to the next slide. So this is a molar that it's harder to see because this is a tooth that has 2 or 3 separate roots, okay? And they're curved a little bit. You can barely see the gray line inside of the tooth. This patient came to me, and this tooth was killing him. And I said, look, we can do a root canal on this tooth. You can salvage the tooth. It's not a big deal. It'll take about a half hour. And go to the next slide. And you can see the curvature on these roots. That white stuff that's inside of the roots, that's the plastic material that actually fills the canals. And you can see the curve of those canals. And again, years ago, we weren't able to perform root canals successfully on a tooth like this because I couldn't really instrument and get the curve of those roots. Today, these are routine.
So that's actually plastic? Not,
it's
not a liquid?
No, it's a plastic material that conforms. We actually heat it up. We insert it into the tooth. It conforms to the shape of the root of the tooth, and you can see the curve of that root, all right? And that's a successful root canal. This patient will live for many, many years with this tooth.
Awesome.
So now, when we're done with the root canal, then we'll put a crown on the tooth because a tooth doesn't have a blood supply anymore. The blood supply allows the tooth to have nutrients and stays healthy. Without the blood supply, the tooth will get brittle. And so after a root canal, almost always we're going to put a crown on the tooth to help it stabilize the tooth so it won't crack.
Fantastic.
So you don't have to be so nervous about it.
I'm not as nervous at all.
Yeah.
I'm scared to death.
Yeah. This is not Marathon Man. Is it safe? Remember that movie?
Yeah.
That set dentistry back about 30
Jaws.
years. Right. I was going to tell that Marathon Man movie when Dustin Hoffman was, having his front tooth drilled into that set dentistry back. I mean, we didn't have any patients for weeks after that. It was terrible. All right, let's take another break here.
All right, we'll be back.